medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Hi everybody, Mitch Ghen here. I want to talk about aspirin. We forget how great it could be as a clinical proposition for us in many instances. In this case today, in cancer. Recently, Cedars-Sinai cancer researchers actually looked at people that took regular, just a baby aspirin, a small one, at least 15 times a month prior to getting a diagnosis of colorectal cancer. And they said it will reduce, or they believe it will reduce, the risk of death from the disease because it limits the spread of the cancerous tumors. So this was published, by the way, in a good journal. It was published in the Journal of the National Cancer Institute. So it is something to be looked at. And we've pretty much known if you can reduce inflammation, we certainly can have a much better result when it comes to different types of cancers, especially if you do it in advance. Well, associated with a lower rate of metastasis or tumor spread, aspirin, even a baby aspirin, is seen to do that. And starting it even after colorectal cancer, in the case of the study, was not associated with as strong as benefit as the pre-diagnosis was, but they similarly found that the use of non-aspirin non-steroidals, non-steroidal anti-inflammatories, ibuprofen, if the acetaminophen, naproxen, they did not work and they did not confer any benefits. The question is an aspirin probably a good idea to take just one a day or on a regular basis and has so many cardiac positives? Not the discussion for today. Well, colorectal cancer, of course, is a leading or the third leading cause of death for men and women across the world. There's 50,000 deaths of it in the United States. And the American Cancer Society basically estimates that about 104,000 or plus colon cancers and about 43,000 cases of rectal cancer were basically diagnosed in the United States in 2020. The question is, how does aspirin work and how can it help if there already is a cancer? And it does, by the way. And anti-inflammation would be the first thing you can think of, but it does many other things that you should be aware of, including it increases the overall survival of these patients. It reduces metastatic spread. It induces apoptosis. It does induce tumor or inhibit tumor progression. It enhances the anti-neoplastic effects if someone's on chemotherapy. And of course, the anti-inflammatory effects. It actually also aids the blocking of COX-2 and COX-1. Goes both ways. And many, many cancers use COX-2 to grow. So you have a wonderful autophagy glycolysis inhibitor. These are unfamiliar to you. I would suggest looking into it further. But pretty much for gastric, pancreatic, esophageal, colorectal, ovarian, endometrial, lung, breast, prostate, and small intestine, aspirin may be an amazing adjunct to your program, especially if you're enjoying the metabolic approach and you want to use it in addition, perhaps, to the traditional chemotherapy approach. For more information, please go to drmitchghen.com. That's drmitchghen.com. Until next time, we'll see you soon. Thank you.